Without further ado, I will pass it over to our esteemed moderator today, Dr. Abe.
Thank you so much, Megan, for that beautiful introduction. And yes, again, I want to welcome everyone to the webinar and focusing on this series on equity in leadership. We'll be zooming in into women of diverse racial backgrounds shaping the future of global health. And looking through this constructive lens, our goal is to inspire the next generation of leaders while acknowledging the realities in this field. So we'll jump right into the conversation. And just as Megan mentioned, if you have any question or you're prompted to drop any question during the course of the conversation, please just put it in the chat box. We'll address it during the Q&A session. So yes, joining me on this very important discussion are three distinguished women who have been making significant contributions to advancing global health. And I'm happy to have on this virtual table. I call this virtual table because we are not seeing each other physically. So the first person I will introduce is Dr. Adiola Folorunsho, who is a global health advocate, championing mental health equity for mothers, fathers, and children, and also neurodivergent communities globally. Welcome, Dr. Folorunsho. Again, I also have Dr. Olukemi Olugbade, who is a public sector primary care physician, a public health specialist, and also a field epidemiologist. She has expertise working with professionals and health institutions, delivering health services and solutions to underserved communities. And she has been committed to strengthening health systems, reducing inequalities, and ultimately improving health outcomes. Welcome, Dr. Olukemi Olugbade. And last but not the least, I'm honored to have Dr. Adebola Ajao, who is a leader in epidemiology and also a founder of Empowering Initiative. She has dedicated over 2 decades to public health and women's health, and her expertise in infectious disease is on infectious disease, drug safety research, and also leadership development. Thank you so much, ladies, for joining this conversation. And I will just jump right into the first question, and I'll be taking on Dr. Ajao to take the first question. And I'll be leveraging on your experience in leadership thus far. What would you say or you have identified as the most significant structural barriers to women of diverse racial background, what they might have encountered while pursuing leadership position in global health? And based on your personal experience, how have you personally navigated some of those challenges?
Yeah, thank you so much, Dr. Habe. Can everybody hear me? Thank you so much.
Loud and clear.
Loud and clear. Awesome. Good afternoon, everyone. I'm happy to be here. Thank you for that kind introduction. And yeah, you raise a very important question. And what I found in my 30 years of experience being in the US, originally from Nigeria, is the limited access to senior leaders and senior networks. I do believe that it's in those informal spaces, but very important informal spaces, is where the conversations are happening. This is where the connections are being formed. This is where the opportunities are being discussed. This is where the mentoring and the collaborations are being fostered. And sometimes as women from a minority descent, we don't have access to those networks, those leadership networks. And that really does limit our growth. It does limit our potential to become leaders. I think another important one is limited access to funding. I mean, there's data out there that women or just people of minority racial backgrounds are less likely to be funded for research. They're less likely to get opportunity to get their proposals funded. And this is a big limitation because it really does limit us from being able to lead essential research in our communities that are important, especially culturally competent research that are really important. And so the way I've navigated this in my, again, 30 years of experience in the US is that I've been intentional to really try to build cross-institutional relationships, meaning I've tried to go outside of my institution or my organization to find opportunities, to find peers, to find mentors, and to really leverage outside collaboration beyond my immediate professional environment. And this has opened up collaborations for me. It has opened up joint opportunities for funding and especially a support system and a community, because I think ultimately that's what's important. Having that professional network of support system to really help us in our growth as a leader and as a professional. Thank you.
Thank you so much, Dr. Ajao. I like that very crucial point you made there, being intentional about building cross-institutional opportunities. My next question is directed to you, Dr. Olugbade, and this is based on your experience that spans both clinical and public health space. Looking through this lens into underrepresentation, for women of diverse racial background, how have you seen underrepresentation impact public health development and even ultimately health outcomes in different regions, based on your own experience?
Okay. Thank you very much, Dr. Abe, for the very timely question, because this question is very reflective of what is going on in the global health space at the moment. And so the underrepresentation of women from diverse racial backgrounds, health policy and development can lead to gaps in addressing community-specific needs. And this results in policies that are less effective or even misaligned with the needs of the communities that they intend to serve. And so in my experience, what I have seen is that diverse perspectives and contributions are crucial in shaping health policies that are inclusive, that are representative and effective. And so when women from different racial backgrounds are involved in policy development, they can bring in a lot of insights, that would have been missed if, these women's voices were not heard. So let me give an example of a particular situation that I came across. So there was this meeting in Nigeria on non-communicable diseases and its impacts on the healthcare system, especially at the primary care level. And there was a particular panelist and speaker, and then she has a foundation that looks at hemophilia. It's a hemophilia foundation, and what she said was that many times women who experience postpartum hemorrhage could have experienced it because they have blood disorders. And even though hemophilia does not directly affect women, because it's more common in men, but it could affect women in the sense of recurrent miscarriages and having to take care of a very ill child that is recurrently bleeding. So it shows that even if certain conditions are not due to race, but the racial disparities could affect diagnosis, treatment, and prognosis. Now, for conditions or situations that are due to race, it has also been found that, there might be racial disparities in accessing care, in getting advocated for, or in receiving treatment. So what this shows us is that when there is no voice to represent a particular set of people of a diverse racial background, then they are missed when health planning and prioritization is done. So there are certain situations that might not affect women directly based on incidence of prevalence. But when it comes to being a caregiver, when it comes to being a policymaker, those factors become very, very important. So it's very pertinent, and it should be prioritized that women from different racial backgrounds should be able to represent the voices of the communities and individuals that they represent. Thank you.
Thank you so much, Dr. Olugbade. Women of their diverse racial background will be able to represent voices from different backgrounds. I want to leverage on your experience in different culture, Dr. Folorenshaw. This question is directed to you. You've had opportunity to practice in different cultural background, and so based on this experience, I want you to answer this question. How has cultural expectations that you have seen in different regions shaped leadership journey for women of diverse racial background? And what approach have you seen that kind of helped to transform some of this expectation ultimately into strength?
Thank you so much, Dr. Abe, and thank you so much, participants, for joining today. Culture is a very big thing. It's a very big deal, and it's a way of life. But sad enough, when it comes to culture, it doesn't really favor women globally. And then not apart from that, now women of, women that representing other, cultural or cultures that are, or women that are not, in that high status or caliber. They are even more racialized, right? Now, the expectation for women globally is that this is the limit a woman should attain, right? So there is already that glass ceiling effect placed on women, right? But as you go to different culture, it is even more pronounced. And so women are beginning to believe, change their mindset, and their brain is also adjusted to believe that this is how far they can go. So now any woman who then tries to get out of that ceiling effect or try to, prove the world that no, I'm different. The world sees them as being deviant, or people women that do not conform to the societal expectation of how women should be, right? They are being seen as being proud, right? So what I want to let people know that all this cultural expectation placed on women are societally generated. It is not biological in nature. So women are meant for more. So now, when you look at the origin of a woman or the capacity of a woman, number one, a woman has that caring capacity, right? So when we take that caring capacity into leadership, into organization, do you know what that's going to mean to that organization? That means the people, the workers in that organization will be well taken care of emotionally. And not just only that, when people in the particular organization are taken care of emotionally, you go check the performance improvement of that organization. They will do well because people will be happy to come to work because they know that they are being led by women that care for them. Also, you look at the aspect of if women actually are able to change their mindsets, that they should not be limited, that because if you look at a woman, the structure or the brain of a woman itself, women are deep thinkers, critical thinkers, right? When you have such women in leadership, they are not just moved by emotions. They are ready to analyze things. So when you bring that skills into organization or into the society, it is a plus. So I want women to have a different mindset that they can change the culture, the cultural belief that the society has placed on them. They should leverage all the natural gifts that they have. Number one being, caring set of people, critical thinkers, people who can take in more. Women they can multitask, right? So they don't easily get distracted or frustrated. So when we have people like that, those are good qualities that any organization would need. So even if we cannot change the whole of culture, unfortunately, it's like you cannot change ancient stones, but we can change it positively to suit us. We can use that opportunity of what we have become naturally, that we carry naturally, and take it positively into the organization that we need. So with that would improve the audacity of a woman to be able to take leadership roles. You don't have to be special. You don't have to be limited. You have the inbuilt energy and gene to lead naturally. So the mindset of a woman should change, that they are ready to take the world into a bigger space. Thank you.
Wow, thank you so much, Dr. Florenshaw. That were some encouraging words there. And I'll follow up with you with this question. Given some of this parameters you just mentioned, we have a couple of people on the call who are looking to also climb this ladder of leadership in their various global health experience or career. And they may want to know if there are certain opportunities that exist for women of diverse racial background. Do you see some particularly promising opportunities for this emerging global health leaders? And what will you advise, or what points will you just give out to some of these enthusiasts as opportunities that exist in this field for them? Go ahead.
I think it's very important, and I don't really want to repeat myself, but you see, there's something called mindset, and mindset, the psychology of mindset in alone can make the whole difference, right? Women should, I'm going to take this personal now. Women should know that they have no limitation. They are their own limitations, right? So what is coming up, a lot of people are coming up together, forming alliances. They are, countries that, like, let me say, women from different cultural background, they're coming together. People are believing in the power of teamwork, right? Coming together to make things happen for themselves, right? So that mindset of a woman should have it all. We are not competing with men. That's the thing. We don't have to do that. There is no need for competition. What we are advocating here is that already you have what it takes to be that impactful leader, right? So the encouraging things that people should see is that look at the leaders that are women that are taking up that wonderful space already, and they are doing amazingly well, right? Leaders across all, women across all racial background, that, when they take up that leadership role, they take it personal, right? They take it as if it's their own personal business. So looking at the people who have gone ahead, so that's the power of mentorship, right? The women that have gone ahead that are doing well, we can always leverage on that if this person can do it, again, it goes back to mindset, then I can do it, and there should not be any glass ceiling effect placed on me. So I will encourage women that they shouldn't wait for the time where they have it all figured out. You can start from where you are, and you can get better. I hope I'm not beginning to sound like a motivational speaker right now, but that's the truth, because people are always waiting for the perfect time to take up that leadership role. We are always screening ourselves. There's that internal screening. I'm not good enough. That spirit of, low self-esteem, imposter syndrome. I'm not supposed to be here. I am a fraud. I'm not. Are you really sure I'm supposed to be here? Like, I don't even have all the degrees. No. That little thing you have, that inbuilt that you have, is just enough. So step out, be audacious, and make impact, because if you don't come out to make that impact, a whole generation might suffer. Thank you.
Thank you again, Dr. Florenshaw. Dr. Ajao, this question is to you. And looking through some of the beautiful works that you have been doing through your initiative, it further suggests that mentorship is very important as you're trying to pull up younger ones and see how you can impact them. We have mixed audience here. We have people who are looking up to climb the ladder, and we also have people who are already there and seeking for opportunities to impact. And this is one of the things that Edge Community is doing, trying to pull everyone at the same time, and no one is left behind. So how can mentorship and sponsorship program be designed specifically to support women of diverse racial background in global health based on your own experience?
Yeah, thank you so much. I mean, mentoring I cannot overstate the importance of mentoring. It's really, truly the backbone. We have to see the people that have gone ahead of us in order to give us the pathway to know how to do it. So nobody's an island. Everybody needs somebody to pull them up. And so so I believe there are opportunities in even all these challenges that we've spoken about today. And specifically, I think that mentoring and sponsorship programs needs to be cross-cultural. I think it's very important that while we typically connect with people that have shared heritage and shared experiences and values, that's our natural state, right? To connect with people that come from the same place that we're from. But it's really important that mentoring programs really cut across cultural barriers. Pairing mentors and mentees across racial and cultural lines is very important, that so that we can leave a shared experience and expertise. We can leverage some of those differences in expertise and experiences across culture. I believe it's very powerful in propelling us as leaders, as female leaders. I think another one that's actually really also important, which a lot of people don't think about, is reverse mentoring. So why most of us think of mentoring as looking up to people, I think it's actually really important to do that reverse mentoring too, and give senior leaders the opportunity to learn from younger ones, especially women of diverse racial backgrounds, in order for senior leaders to understand some of the challenges that we face, right? Some of the systemic challenges that we face. So, and I believe this is not talked about enough. It's not really talked about enough, but it's important that senior leaders get the insight into some of the struggles and the challenges that we face so they can better support us. And I, as a leader, for example, one of the most important things to me is to make myself accessible as a leader, because I've gone through it as a minority. I've gone through it. And so when I see other young females coming up, I make myself accessible to them because they can really learn from my lived experience. And another thing that I think is really important is creating that safe space where we can have authentic conversations about race and identity and culture differences, and how this actually does impact leadership opportunities, and how it's important to have these conversations without any kind of fear of prejudice or judgment or retaliation. I think having that open mind and open conversation is extremely important in a mentoring relationship, because mentees will not open up if they don't feel comfortable. If some of you have lived in the US, I remember as a young mother, going through my PhD program, I never wanted to use my kids as an excuse. I always felt afraid to speak about the fact that I'm a mother and I'm trying to pursue this doctoral degree, because I didn't want to be seen as lazy. So I always hid that part of my life. And I think that's not acceptable, because we have to understand that our lives are multifaceted. I'm not just a professional. I'm also a wife, and I'm also a mother, and I'm a sister, and I'm a daughter. And so I'm all of these things, and I should be comfortable sharing these experiences, because all of these experiences make me who I am. So when women leaders feel seen and heard and valued, women of diverse racial backgrounds feel seen and heard and valued, not just as professionals, but as whole persons, as whole human beings, it really does transform mentorship. It transforms mentorship into a catalyst for racial equity and long-term leadership development. Thanks.
Thank you, Dr. Ajao, for that very detailed response. And I like the fact that you pointed something that is very unique, talking about leaders also looking back, trying to learn from the ones that are still trying to climb the ladder. Thank you for that. Dr. Olugbade, you have walked through different health systems, and I want to ask you this very crucial question.
I'm right here. Yeah.
Okay. So what role can intentional international network play in amplifying the voices of women of diverse racial background in global health? Emphasis on intentional.
Thank you very much.
Yeah.
Yes. So this meeting is part of intentional networking and collaboration, because the panelists came together based on the relationship that was fostered by one person who then connected every other member of the team, so to speak. So intentional networking and collaboration is, a product of being able to identify potentials in different relationships that one connects with through different platforms, either from work or from a webinar or seminar or from colleagues in both the local and global space. Because especially in global and public health, it's as big and busy as different specialties in global health and public health are. It's still a small family, because somehow you get to connect through your institutions or your labs, or from LinkedIn or other professional networks. So intentional collaboration is very possible when, like I said, people identify potentials, like with Dr. Adiola and the work she does in Matermental, that I identified from a particular seminar where both of us were invited to as speakers. And then from then on, we forged a professional relationship that has grown into a mutually beneficial one. Now, COVID made it easy for a lot of people to connect on that level because of the different platforms for communication and learning that came up during that period. But we don't have to wait for an outbreak or a pandemic before we connect. So it's good to leverage on professional platforms, on meetings, seminars, and conferences. And networking intentionally means that at the point where you are interacting with the person or persons or institutions that you have an opportunity to meet with, you're not coming from the place of demand. You're coming with value, you're coming with a solution, and you're coming with ideas to foster the relationship. And these relationships are very important because they help to draw attention to issues and health problems that many times people may not have paid attention to, or may not even know exist, or may not even identify with, because of their own privilege, so to speak, or the fact that it might not be a burden or a problem where they live or where they exist. So this intentionality in networking is very important to foster ideas, develop interventions, develop research ideas, and then to also solve problems across continents. Another thing I would like to add is that after the networking or connections have been established, it's also important to maintain them, because many times many people network at conferences and meetings, and after these events are over, everybody just goes back into their busy schedule. Or if a project that a team formed was collaborating on is delivered, then nothing else happens until another project is coming up. But leadership is not like that. Leadership is consistent, so you don't take a break from leadership. As long as you have the position or responsibility of a leader, then you have to ensure that you're committed, you're consistent, and you do your work with everybody's interest in taken care of. Thank you.
Thank you again, Dr. Olugbade. I'm going to ask you a follow-on question, and I'd like some points that you just made there. Maintaining network, which is very, very important, and coming with value, not just from a place of demand, which is something that is also very, very important for everyone to. And I want you to hold your thought right there. I just want to remind everyone, in case you're just joining the call, if you have any question, please put it up in the chat. We'll take it during the Q&A session. Dr. Olugbade, you mentioned something around coming from a place of also having something to offer. And this takes me to the next question, which talks about going beyond technical expertise. We have a lot of people with global health skills as a medical doctor, as a research scientist, and also as a public health person. What leadership skills should women, maybe on the call now, or those who will still be listening to this later on, who belong to the diverse racial background, particularly focus on in a bit to develop and also thrive in global health leadership?
Excellent question. Can you hear me?
Yes.
Okay. So it's very important for women of diverse racial backgrounds to be able to identify their self-worth, 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 their value, the value that they bring, self-awareness and their self-identity. Now, the context of this is that it's not just about being female, or just about being a woman. You have to appreciate your skills, your capacities, your competence. What are you bringing to the team? What are you bringing to your institution, your university, your lab? Who are you? What are your core strengths? Do you work best with a team, a big team or a small team? Do you work best with, do you work best with a lab, or would you rather teach? Because leadership comes in different forms. Leadership is about influence and impact. It's not just a title. Okay. So there's some people that like to work in front of the scenes. They like to be very visible. While some people like to work behind the scenes. It does not change the fact that they're leaders, but in the context of their leadership deliverables is just different. So it's important for women who aspire to leadership to know what their strengths and weaknesses are. Strategic communication is very important in leadership, because with leadership, you have to, communicate. Like I said, it's about influence and impact. And your communication might be direct verbal, it might be written, it might be from a place of public speaking or private coaching, but you have to, have strategic communication that is clear to your audience. When you have to do advocacy, and then you are speaking over the heads of the people that you are, advocating for, they will not be able to appreciate your intervention, because they can't even relate or connect with what you are saying. So that's why in community engagement and in risk communication, we talk about the fact that you talk with simple language that people can flow with and understand. So strategic communication is very important in leadership. Also, resilience and adaptability, because there are times when you would have conflicts, so you must be able to be very skilled in conflict resolution. When it comes to working with in public health and in global health, we work with teams. We work with people from different backgrounds, cultural backgrounds, social backgrounds, economic backgrounds. You have to be able to put everybody's contributions and representation in perspective. And then at some points there might be clashes, so you should be able to adapt to understanding where they're coming from and how to make sure that everybody's ideas are heard. And then, this situations too could be stressful. So a good leader must be very on top of stress management and self-management, managing their time, and then even the resources that you're entrusted with, accountability, transparency, very, very important. And then you must also be a very good collaborator, and you must be able to form partnerships, because with global health and public health interventions, you can't do it alone. Many times we talk about funding, and these are important resources needed to make a difference in communities. In many of the communities we serve, underserved communities, these people are marginalized in every way, then in accessibility, affordability, and quality of care. There are challenges because, there's very little resource for health financing. So if as a global leader, a global health leader, they're coming in to make a difference in that community, you must be able to raise resources. You must be transparent and accountable in the way the funds are disbursed, and you must bring value to the community or the set of people that you're trying to help. And there's no way you can do this without collaboration and partnership. So essentially, these are leadership skills and qualities that women of diverse racial backgrounds should be able to work with and work on, so that they can scale. Now, another important thing, yes, let me not forget, that by the time you now find yourself thriving in this space as a leader, you should not shut the door against other people aspiring to become leaders. There was something I read recently about the queen bee syndrome, where when women have aspired and gotten to places of leadership against all odds, when they get there, sometimes they shut the door against other women. And this many times does not allow for, sustainability. There should be a legacy. Every woman leader, every public health and global health female leader should have the sense of legacy, in leadership. I'm doing something great. I'm making an impact. I'm a person of influence, and I'm bringing the next generation along with me. Thank you.
Thank you so much, Dr. Olugbade, for that very comprehensive response. Leadership is about influence and impact. And that takes me to my next question to Dr. Folorunsho. Folorunsho, thank you. In your years of leadership experience, what practical strategies have you seen that worked, or have you observed that worked, that help this group of people, women of diverse racial background, and that they may imbibe to successfully navigate the complexities? We've heard different challenges that was mentioned by Dr. Ajao, and also even yourself and Dr. Olugbade, in global health leadership.
Yeah, thank you so much. I think women should know that leadership itself it's not a walk in the park. So we're not coming here to joke. So when women come with the mindset that they want to make impact, then that comes with responsibility and preparation. So you cannot say you want to be a leader and you're not ready. Then that means you're not, it's a joke, right? And when you begin to make jokes, then you know what that means. Nobody's going to take you serious. So when women see leadership role as responsibility, and women should not to be focused on just the title. The focus should be on the impact. He who wants to lead should be ready to serve. And when you're serving does not mean that you are the least in the team. When you serve, when you come with the mindset of, I want to make impact and I want to serve the people, it is very easy for people to come to you. You are more accessible, right? So when it comes to leadership, you have to be prepared. And in what form of preparation? Experiential preparation, learning from, just like Dr. Ajao had mentioned, learning from people who have gone ahead of us. So mentorship. So you cannot just wake up one day and say, I want to be the WHO leader. It is a process. It's something that you have to build over time, right? So you have to be strategic. So if women really are serious about leadership and they want to make impact, so the experience should not be taken away. So you cannot just wake up and say, I want to take up the leadership role, right? So you have to be prepared. Then another thing is educational preparation. Education is no scam. It's not a scam, right? So when you go into the four corners of school, there are so many things you will learn that is applicable. So you have to be able to apply that, right? So that educational preparation, experiential preparation is very important, because the goal, your goal is to go and make impact, right, in people. So it is important we do not joke with the power of mentorship, right, when it comes to we wanting to make impact. And then another thing is that leadership itself, like I mentioned, it comes with responsibilities. So And when I say responsibility, it is an ongoing preparation. So leaders, women who want to lead the nation must be ready, open-minded, open mindsets, right? Emotionally intelligent, because of when you look at the world generally, the globalization is just on the rise, right? So you see people, you're going to lead people from different racial background. How are you going to perform? How are you going to lead such organization when you're not open-minded? So women who wants to take up the leadership role should be open-minded, culturally competent, because you're not going to be leading people of your own racial background alone. You're going to be leading people from different background. So you don't want to be biased. You don't want to racialize or ostracize one particular race in your team, because it's going to affect the overall performance of the organization itself, right? So the preparation is very important. If you want to lead, be ready to pay the price, because leadership is not a walk in the park. So be connected to the people who are already in that similar space, people who have gone ahead of you. It's wisdom. A particular word from Isaac Newton, he said he was able to see beyond his horizon because he leaned on the people's shoulder. So the height of Isaac Newton was, higher than his peers, because he leaned on the shoulders of giants. So mentors, right? Ongoing preparation, ongoing. And another thing that is very important, I know sometimes as women, we could be very emotional, but we should be open to feedback. Feedback are very important. I remember one time when I was the director of care back in Canada, and after spending 6 months into that role, and I was leading a team of over 250 staff, all Caucasians, all Caucasians. I was the only person of other racial background, very young. I was just 29, leading people who could be my mother's age group or even grandma, and the race itself. So after 6 months, I was interested to know how far I'm doing, because people will not come to tell you how you're doing, or people will just they don't want to hurt you, right? And as a leader, you should be open for feedback. So you know what I did? I created a questionnaire, and different aspects. There's aspects of the performance, there's the aspect of emotions, different aspects that could guide if I'm on track, if I'm delivering. Because like I said, my goal is not just to say I am the leader with my shoulders raised up. No, my goal there was to go make impact. And the only way I can do that is that I cannot be a leader if I do not have followers.
Yeah.
So I should be conscious of my followers. How are they feeling about? Are they feeling me? If my followers are not feeling me, then I'm just on my own.
Yeah.
I'm just on my own, right? So what I did, I created a questionnaire, and I said everybody should respond blindly. You don't have to put your names. Honestly, that was the honest feedback I've ever it opened my eyes to, there's something we call blind spots. Women should be prepared to see their blind spots. They should meet their blind spots with positivity and not with negativity. Be open to positive criticism, because it helps leaders to grow. So that blind spot is what is seen by others, but you cannot see that.
Yeah.
Right? And when you are open to that, it helps you to drive the team, because it shows you care. And you remember I mentioned about the characteristics of women naturally that we need to take into the role of leadership. We don't have to even start to.
Sorry, Dr. Folorunsho, sorry to cut you in. I just want to ask my follow-on question, just so that you can just pull your thoughts together and be able to round up that with it. I also wanted to mention something around why we identify the challenges and also the opportunities that are in this field. I want us not to leave out the institutions. Let us also do some key learnings and reflections for the institutions. How do you think, or what accountability mechanism could institutions also foster to really look into the inclusive leadership for women of diverse racial background in global health, together with you? previous thoughts briefly. Thank
Yeah, it is important that when organizations want to actually, and they're serious, it is not just talking about equity, diversity in paper, but in reality, it's not being practiced. So it starts from the recruitment process, right? So in the recruitment process, everybody has a fair game, fair chance. So not that it's even so funny. I don't know if you've heard about this. When people are applying for a particular role, say for instance, my name is Orishagbemi. For instance, a very long name that people can identify that is coming from a particular culture. People would have to change their name to Victoria, right? Just to fit into, because they know that when they apply, saying that name, they're going to trash that resume, that this one doesn't belong here. I think organizations should be open-minded, that people, if they truly want to practice diversity, inclusion, and equity, everybody should be given a fair game, and it should be based on merits and not based on emotional assumption that people of this particular race or people of this particular gender cannot perform more than this, right? So, because when that is put into place from the recruitment process, and not just only that, when that person is then being hired, there is a place of retention, because a lot of people start, leaders, people like, I've seen a lot of scenario whereby women of different racial background are given the opportunity of leadership, but they do not sustain that, not because they're not capable, but because the environment is not conducive, the environment is toxic. And so they are being forced to leave. And so that causes a lot of emotional trauma, right, on them, right? So beyond the recruitment phase, be prepared to support women, when women of different racial background, when you hire them, such that they are being supported and they can perform, because it's a thriving environment. When you give them a good, it's just like a plant, a seed. If you give a seed a good soil, it will germinate properly. So that aspect is very important. Thank
you, Doctor. I know if I leave you on, you just keep sharing your thoughts and your own lived experience. I still have questions around lived experience. So let me just give Dr. Olugbade this opportunity to paint a picture very briefly on what we should be looking at if we are looking at a truly equitable global health leadership landscape. What are the first signs to see that we're really moving in that direction? Dr. Olugbade, very briefly, please.
Thank you so much. So if we're looking at good representation in the global health landscape, it's very important to ensure adequate representation. So the buzzword that we always say, representation matters, is actually very true. So representation matters, from Africa to Middle East, from North America to South America, from Asia to, the very marginalized parts of Europe and Australia. It's important that representation is adequate across, different racial backgrounds. Another important thing is to look at, very apt, as you brought up, our institutions. So for the institutions, I'm very glad that Johns Hopkins is a global institution, and it's important that the modules, the content of the different modules are also representative of the global health issues, such that, since they have a diverse, background of students, undergraduates, postgraduates, doctoral students, the modules reflect global health issues that are relatable, and are consistent with what is current, and, the burdens, that people can appreciate, relate to, and prefer solutions to, because it is from those places that leaders are grown. And then another thing is being empathetic, being emotionally intelligent, to see that even though, people have different competencies and capacities, it's important for them to be given a chance. There's this situation of what's called performative inclusion. And so what performative inclusion means is that, it's only when something is going on that people are invited to the table, but there is no consistency or continuity. So when it's International Women's Day, there's a lot of hype and buzz about women and what they can do, their strengths, their abilities. But when decisions relating to women's health are being taken, those women are not there when the funding is being allocated, when the decisions are being taken, when the slides are being presented and the funding is being distributed. Women are not remembered. So let's not be performative and then exclude people when it seems convenient for us to do so. So I want to see that the picture should be that of representation, inclusion, and good content across board. So from the institutions to organizations, from teams to research labs, there should be adequate representation of female in leadership positions, and this would have been done from different exposures, especially in the educational sector, from the models to giving them opportunities to lead in school. Because when you give people opportunities to lead in school, thereafter, by the time they leave school, you've already deposited the boldness, the confidence, and the capacity for them to handle tasks and responsibilities that leadership requires. Thank you.
Thank you, Dr. Olugbade, for that very insightful response. Dr. Ajao, I have two questions for you in one, and I would like that you're very brief with me. Dr. Ajao, I know that just as Dr. Olugbade said, the content matters. How do you think educational institutions during the phase of preparedness could better prepare women of diverse racial background to be able to handle specific challenges that could that they may encounter in the face of global health leadership? And one very important part of I will direct to the three of you is your lived experience. When you are done with this question, which is the first question, I want you to also share briefly your lived experience in your ladder of leadership. You're holding very powerful position in global health, and you have been able to impact lives through your initiatives and in other means and presentations. What are some of the things, key take-homes or key takeaways from your lived experience that you will be willing to share with every woman that is aspiring to be like you in global health? Thank you.
Thank you, Dr. Abe. So many wonderful things have been said, so I'm not gonna touch on some of those things. I think one thing that it's very important is the leadership training. A lot has been said, but I think women are not adequately trained to become leaders. And so leadership training should be tailored to help women navigate very complex and often inequitable environments. Most of us find ourselves as either the only woman or the only woman of color in these leadership positions. So I think it's important to train women to become leaders, and perhaps through storytelling, right, where women of diverse racial backgrounds can share their stories of strategies and tools that they've used to navigate this challenging environment and equip other women that are coming along with these skills and competences to be able to lead. In addition to that, organizations forming strategic partnerships with global organizations that prioritize diversity, that allows diverse voices to be heard, that offer real life experiences in mentorship and exposure to diverse leaders. I think those are very important. But as far as my take home, that I'm going to leave with everybody today, and this is through my lived experience. This has already been said about leadership is about impact, but I want to also add that leadership is about service. Leadership is about service. I think Dr. Adeola said that. So for me, leadership is about service and impact. And I believe there's a leader in each and every one of us. I do believe that the world needs our leadership and that we should not wait for permission to lead. A lot of people think they need to lead only when they have a title. I don't believe that. I believe that we're all equipped to lead. And I think that's been mentioned before. So don't wait for permission. Start from where you are. Be bold in using your voice. You have a voice. Believe that you have that voice and believe that that voice is important. So start from where you are. Use your voice. Be bold, even when that voice is shaky. Sometimes we don't have the confidence, but guess what? If you don't practice using your voice, you're going to lose it. So it's really important that we use our voice and that we seek communities. Our communities are going to be our support system. They're going to be the ones that give us opportunities and visibility and support. And so it's really important about that. Also, that leadership is not about having all the answers. It's really about showing up with intention. It's about showing up with integrity. It's about showing up with inclusion, and it's about showing up with purpose. So with all of those things said, the future of global health really depends on diverse voices and diverse experiences in leadership. When women of diverse backgrounds, when they're empowered, when they're equipped to lead, we really do create culturally important, culturally competent health systems, and we really do get better health outcomes.
Thank you so much, Dr. Ajao, for that very impactful statement you made there. I have just one question. I'm on the question and answer session now. And this should be directed to you or Dr. Olugbade. I don't know who, I think it was you that mentioned something around networking and trying to reach out to people that have gone ahead of you. Dr. Olugbade emphasized maintaining some of those networks. So how do you maintain this network and relationship during the course of your journey in global health leadership?
Yeah, thank you for that. I think Dr. Olugbade said it well, not to just go to these forums and have a good time and go home. Every single time I go to an event or whatever it is, a conference, I always have the intention, I'm always very intentional. And I always find 2 or 3 people that I connect with. I mean, you can say hi to a lot of people, but I would connect with 2 or 3 people that I'm going to carry that relationship forward. Meaning I'm going to follow them on LinkedIn. I'm going to follow them on Instagram, Facebook, wherever you find each other. And I'm going to stay connected with them. I'm going to respond to their comments. I'm going to comment on their postings. And guess what? I do believe ultimately when you need each other, those opportunities will come up when you're going to need each other. And that's actually the story of Dr. Adeola and myself. That's how we connected. We didn't know each other before, but it was intentional. And I noticed that she noticed me and we started to follow each other. And here we are. And I'm sure there's going to be multiple collaborations in the future. So it's really about being intentional with who you're connecting with and following up. Keep following up so that when the opportunity does come up for collaboration, you've been intentional in following that person.
Thank you again, Dr. Ajao. So I will just briefly, we're rounding up now. In a few minutes, we'll be done. Dr. Olugbade, your final thoughts for everyone who is here trying to get on the ladder or who is also looking for a way to make impact. Your final word as we wrap up. And also Dr. Folorenshaw, when Dr. Olugbade is done.
Thank you very much, yes, for this opportunity. So the high points and action points from this conversation has been that leadership is not just a title, it's about impact, it's about influence, and it's about inclusion. And so as we aspire to leadership, and for those of us who are in leadership, as we fulfill our roles and responsibilities, it's very important to keep these key points in mind and to function from a place of empathy, of emotional intelligence, and from a place of engagement across our communities, individuals, organizations, and wherever we find ourselves. Thank you.
Thank you, Dr. Olugbade. Dr. Folorenshaw, please go ahead.
Thank you so much. I want to leave everyone with psychology 101 of leadership, which is women should be audacious and be ready to break those ceiling effects that is placed on them that they cannot lead. Women are not limited to kitchen. Women are not limited to a particular role. They have the wing to fly. However, when you reach the ladder, be prepared to bring other people along, because in teamwork, we do better. And in collaboration, we achieve more. Thank you.
Thank you so much, exceptional panelists. And I know everyone on the call will agree with me that these people have been exceptional, and they've made some very insightful conversation with me today. And I must just let you know that we are proud of your contribution to leadership, and we hope that we have more women thriving in this diverse techniques and leadership in global health all around the world. And so I will yield to Megan to wrap up this session. Thank you again, everyone.
Yeah, thank you everybody so much, Dr. Olugbade, Dr. Foloronso, Dr. Ajao, and Dr. Abe with your skilled moderation and just everyone's thoughtful comments. I know everybody here, all the thanks are coming in the comments here. So we really, our gratitude to you, yeah, just for sharing this really important conversation. So yeah, looking forward to more collaborations in the future. And I hope everybody has a really great rest of their morning, afternoon, and evening. So thank you so much, everybody.
Thank you, everyone. Bye.